Congratulations on starting your journey towards long-term symptom relief with Axonics Therapy. This video will cover activity restrictions, recovery expectations, managing your stimulation, Axonics Support, basic instructions, and reminders to help you manage your therapy. In the first few weeks after your procedure, it is recommended that you limit certain strenuous activities, such as repetitive bending, twisting and bouncing, stretching, lifting heavy objects, or sexual activity. This will help ensure your lead remains in place to deliver effective therapy. Your doctor will let you know when you can return to work and regular activities. They can also give you more detailed instructions about bathing to ensure proper healing at the incision site. A small amount of pain at the incision site is normal as you heal, but if you have increasing pain, redness, discomfort, or drainage, contact your doctor. Your stimulation should be on 24 hours a day, 7 days a week. You may feel a small, gentle amount of stimulation or tingling, but it should not be bothersome or painful. Do not turn off stimulation unless you feel persistent pain or are directed to do so by your doctor. In the first month or so, you may need to adjust stimulation levels to achieve your desired symptom relief. If you're doing well and getting symptom relief, there is no need to increase the stimulation. It is important to know that you do not need to feel stimulation to know that your therapy is working. If your symptoms are controlled, but you do not feel any stimulation, don't worry. Your stimulator is still working and delivering therapy. If you notice that your symptoms are not improved, you should increase the stimulation level by using the remote control until you feel a comfortable sensation. Keep in mind, every patient responds to therapy differently, so you should consult your doctor if you have any questions about your therapy and what you are experiencing. At Axonics, we want to ensure you're a success with this therapy, so you'll have a dedicated team to assist you. Along with your doctor, you'll also have the support of the Axonics clinical team and calls from our therapy support specialists to check on how you're doing and answer any questions you may have. If you have additional questions, you can contact your Axonics clinical team member directly at 1-844-622-6922. And remember to bring your remote control and any accessories with you to all follow-up appointments.